Good afternoon and welcome to the Multicultural Media Online Conference hosted by the Multicultural Health Communication Service, Ministry of Health with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service. I'm your moderator for these sessions and we're so happy that you've joined us today. And this week it's National Diabetes Week, and the topic of today's forum is type 2 diabetes prevention. It's to make awareness of why it's important to know about diabetes prevention. And today we're so pleased to have with us here today with Dr. Kerry Chant, Chief Health Officer and Deputy Secretary of New South Wales Health. Dr. Kerry Chant, it's so nice to have you here again.
It's an absolute pleasure.
Thank you. And we also have Dr. Tamara Milder, endocrinologist of St. Vincent's Clinic and Senior Research Associate of University of New South Wales. Dr. Tamara Milder, thank you so much for joining us.
Thanks very much.
Thank you for making the time to be here with us today. And we're so pleased to have also dietitian from the community, Nisha Thacker. Thank you so much for being here.
It's my pleasure to be here.
Thank you. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are joining from today. We pay respects to elders past, present, and emerging, and pay respects to our Aboriginal colleagues and communities who may be joining us in this session. We also extend that respect to all multicultural communities, leaders, community leaders, and refugee communities that are represented in this session. Today, it's really important, and I know that this is a priority of New South Wales Health, Dr. Kerry Chant. Dr. Kerry, what is important? Why is it that we need to know about type 2 diabetes, and why is this a priority from New South Wales Health?
Diabetes is a priority because we know that it has such significant impacts on people's health. We know that it's a major cause for renal disease, for cardiovascular disease. Almost every system within the body is impacted by diabetes. We know that there are some things that can be done to prevent diabetes, so we're very interested in ensuring our community remains well and that our community is supported to know what actions they can take to prevent diabetes. But also we know that whilst we have reduced the age standardised rate of diabetes in the population, because we're ageing, so that means that our programs work, but because we're ageing and we know that age is a significant association with diabetes, we actually know the prevalence, the amount of people with diabetes in our community is really going to increase radically. So that's why it's sort of almost a call to action that we have to do much better for patients that are at risk of diabetes, reduce the population's risk of going on for diabetes, and also for those members of the community with diabetes, support them to optimally manage their condition and to ensure that they don't go on to have complications.
I guess a lot of people know of diabetes 1, but why is it important to prevent diabetes 2, and what is it?
So diabetes refers to, there's a few different types of diabetes. The one that's most common is a type 2 diabetes. And that happens when there's too much sugar in the blood for a long time. And this can cause, as I've said, problems for most of the systems, your heart, your eyes, and other parts of the body. And so when we eat carbohydrate foods, the body turns them into a type of sugar called glucose. And what we normally do is our body releases a hormone or a thing that substance that called insulin that helps us lower that glucose from our blood and moves it into the muscles and other parts of our body system where it's used to generate energy. But in type 2 diabetes, the body does not have or does not use insulin, does not have enough insulin or use insulin properly. And what we see is these higher blood sugar levels. Those higher blood sugar levels, that's a real tongue twister. Those higher blood sugar levels can lead to those long-term complications. They impact on all parts of the body system, the eyes, the hearts, the kidneys, and other parts of the body, creating inflammation and contributing to blockages, which lead to failures in those parts of the body.
Well, I'm sure a lot of the people here watching us online and our communities, we know of someone in our families who would have diabetes and who's been affected by diabetes in some of our families. But Dr. Tamara, what is the difference between pre-diabetes and type 2? And, you know, one of the questions is, and a lot of people may be asking, can you reverse diabetes?
Yes. You know, it's all a continuum that, you know, in terms of pre-diabetes and diabetes, because, you know, there are a number of tests we do. You know, one test is we look at your fasting sugar level. So, you know, a fasting level of sugar level of over 7 on 2 occasions marks diabetes, but, you know, at 6 and above to 7, 6 to 7, it's a progression from pre-diabetes to diabetes. We also sometimes do a 2-hour glucose test, and, you know, we look at the result at 2 hours. You may have also heard of a HbA1c, which is, look, that's a 3 months. It gives us a 3, you know, an idea of your sugars over the last 3 months. And there are certain levels that are set for pre-diabetes, and then at a certain level it goes to diabetes. And we make these decisions on what defines pre-diabetes and then, you know, diabetes. But the good thing is you can do a lot at the pre-diabetes, because obviously that's very early on, and it's a much earlier stage of the disease. You can do a lot. You can reverse it, and, you know, you can do, we know that if you, especially weight loss of, you know, maybe 5 to 10 kilos would halve your chance of developing type 2 diabetes. So, you know, that's a moment of feeling empowered to do something to reverse. And, you know, because we also know that the higher your sugar is, that's certainly closely linked to some of those complications. So we're trying to be moved to a level where you wouldn't be so much at risk of those complications.
To ask Dr. Tamara, thank you so much
Yeah.
for that answer. But I wanted to ask, so for the benefit of the
Yes.
people watching, what is your role as an endocrinologist? I think that's really important for
Yes.
people to understand.
Well, diabetes is a very much area where we work as a team, and so a lot of, you know, we're very grateful for our general practitioners who work very hard and who are doing the bulk of certainly diagnosing and managing people with diabetes. For more complex cases, we are, you know, as an endocrinologist, you know, a physician. I'm an internal medicine doctor who's then gone on to specialize in hormones. Diabetes, as Dr. Chant, you mentioned, relates to the hormone insulin and other hormones. So that's why we're involved. Some of us have a greater focus of our work is in diabetes, and it, you know, it involves many other allied health. We have diabetes educators involved, dietitians, Nisha's here, exercise physiologists, and the more you can you know, utilize as a patient of everyone's services, the more empowered, you know, you are. So we all have a different but complementary role in this disease to help patients.
Dr. Tamara, Dr. Chant, it's a whole team, isn't it?
It's a whole team that can be involved, but I think one of the issues is that your general practitioner can manage many cases of type 2 diabetes, but they may need to call on Tamara and other dietitians, whether they be in the public system or the private system. They might need to think about how to support you improve your physical activity by engaging in, Tamara mentioned an exercise physiologist, but it might be as simple as looking and providing ideas around exercise that would meet the needs to improve your diabetes, your glucose control. We know physical activity, good diet are underpinning factors that need to be, regardless if you're pre-diabetic, the general population without diabetes risk, pre-diabetic or diabetic, we know that physical activity and having a good balanced diet is incredibly important.
Thank you, Dr. Chant. And if you're watching, please, if you have some questions, please put them in the chat and we'll ask Dr. Chant, Dr. Tamara, and also Nisha. Now, we talked about food, we talked about lifestyle. What food should we be avoiding and what should we eat to keep our sugar levels steady? And Nisha, you may see this a lot in a lot of the communities.
Absolutely. So I think before I answer that, I want to also tell to the viewers and listeners that the awareness is a good thing. but action combined with awareness is where we're going to make difference. So I hope you can pick up something from today where you think you can implement in your daily lives to actually make a difference. So coming back to your question, I really feel that there's a lot more power in diet, food, and nutrients to reduce, delay, or prevent the risk of diabetes. And I'm saying this because I see a lot of the patients from South Asian community where they come with the idea, my parents had diabetes, so I'm bound to have, so I'm not going to do anything much about it because it's in my genes. And I tell them, look, the power is in you. The stats tell us about 58 to 60%. There's a chance to delay or prevent diabetes. And so if we talk about food, it comes back to the basics, which means we want to make sure your diet has lots of fiber. And so fiber is important because it keeps you regular. That's one thing. But when we look at it in the context of blood glucose, it helps to slow down the release of blood glucose. And that means you feel fuller for longer. And so you eat as per your appetite, you don't eat more. And when you do that, you're managing your weight, which helps manage and prevent diabetes as well. So we want to make sure there's a lot of high fiber foods. So things like whole grains and cereals, vegetables of different kinds, fruits, lentils, legumes, nuts, and seeds. And I want to really emphasize that a lot of the traditional diets do have these whole foods. So preserve those healthier aspects of traditional diets of millet flour blends and things like that. So keep that more in your diet and limit the intake of added sugar foods and drinks, because these are the ones that are going to drive the sugar level quite
And
quickly.
swapping food, right?
Absolutely. So I think there is room for swapping the ultra high processed foods with high fiber foods. And then that way you can manage your weight, manage your blood glucose, and also the other issues that might be there, like cholesterol, and preventing the risk of kidney disease as well.
But you also mentioned, Dr. Chant, that we are all aging, and this is inevitable. And so physical activity and also diet is as important as that.
Look, my own general practitioner told me that it's more important that I maintain physical activity as we age than thinking about it when you're younger, when you've got wrangling the children and other things where you're naturally accruing that physical activity. So I think we have, choices. We want to also make it easy, because I think we need, the message that you'd said, Nisha, about maintaining. You don't do anything special, like think about the elements of what you normally do and how you maybe can modify them or twist them a little bit to meet the healthy food needs. We're asking you to take proportionate, reasonable steps, but it really is important for you and your family. And also another little quote is, we know that some of the behaviours get set very early. So we know that even as young as babies, and what we're doing as babies get into their toddler years is critically important. We know also the teenage years are another sort of important time. So as a family, I suppose, think about how we build physical activity into our days, all the activities we plan on weekends, those bushwalks, those picnics, those beach activities, the physical activities. They don't need to be expensive, but think about things that give your family joy, but can actually give you physical activity. And we know that that's important for your health, but also your physical and mental well-being.
And I think intergenerational, that's what you're saying, bringing the family together. And this is about, when we talk about multicultural communities, it is important that family history, knowing that, then as a family, you can work together.
Absolutely. I think it's a family-based approach that helps especially children growing up. And I like the point what you said is we want to bring the focus of joy sometimes away from food and towards physical activity. I think the rewards a lot of the times as parents end up giving, again, with all good intentions, that we're going to have something sweet after this if we finish this. But instead of that, if we say we'll go out for scootering or we'll go for bike ride, then that's kind of changing the psychology towards reward as well in the long run.
Dr. Tamara, we've spoken a lot today about eating healthy foods and being active to reduce diabetes. But what other lifestyle factors can increase the risk of diabetes based on your research and your work?
Yes, thank you. Well, there are many factors. I certainly think, we touched on family history, ethnicity, certainly certain groups are at higher risk. A major factor, and that's been a big cause of the rise, of diabetes is the risk factor of overweight and obesity, which certainly is linked to type 2 diabetes. Increasing age, women who've had a history of gestational diabetes, that certainly needs close follow-up. So there are quite a number of risk factors out there, and there are many things in addition to both good nutrition and physical exercise, good sleep. Good sleep's important for how you feel. Certainly smoking cessation is very important for your overall health, and also reducing those risk of diabetes complications. Mental health is an important part of it. And I just want to echo those comments. I think also, as Nisha was commenting on, that it has to be sustainable. There's no point, and I'm not a very pro diet, because if you do something and you lose weight, but then if it comes back, which is certainly a big risk factor for diets, it should be sustainable. I'm certainly getting educated about food. That makes a big difference. Just understanding how to read food labels can make a real difference. Those are the types of points. And don't feel as a patient, we often, we all, sometimes want to stick to something, and we fall off so we do something, but just anything is better than nothing, and everyone understands that people have very busy lives these days. So, and also I'd just like to plug, there are resources out there from the National Diabetes Subsidization Scheme. There are many resources out there to help you if you're a patient affected by these conditions.
Thank you, Dr. Tamara. And I guess we have to understand, we are a multicultural society, culturally and linguistically diverse, so many communities, and there are habits that we take in when, and like you said, as when you're a baby, and these are habits that we take in. I guess you were mentioning about traditional diets and how important that is to remember and to take on.
Yeah, I think as a part of moving to a new country, acculturation means your diet is going to change as well a little bit. But I think what we need to do here is focus on what we can learn from the new diet of the country that you're moving to. Take the healthier aspects of that diet, the overall lifestyle, but preserve the healthier aspects from where you're coming. I say that there's so much potential. So the Mediterranean diet is quite widely studied. But if you look at Asian, South Asian, there is a lot of healthier aspects there. So I often say to my patients as well that preserve those aspects, keep those lentils and legumes, because that's one of the high fiber foods which is often missed out, but traditionally was always a part of at least a couple of meals in a day. So I think it's quite important to reinstill faith in those high fiber foods, especially for prevention of diabetes.
And Dr. Chant, that's exactly what we're trying to do in New South Wales Health, is making sure that there are resources available and services.
That's absolutely correct. And I think the other element that we probably have to identify is that the cost of food and fresh fruit and vegetables can sometimes be prohibitive. And Misha, maybe you can comment, but I know that frozen food often is a cheaper price point. And it is nutritious, and canned fruits that are as in juices and not sugary syrups. So there are ways that we can support families to have meals at reasonable price points. And I know, Jess, you've done some work with our teams and also looking at healthy, culturally relevant diets that are actually got a low price point and are simple to make. Because we also know that sometimes people are quite time poor when they're racing that door and they've got those hungry children. So I think we've got lots of resources. We probably need to make them a little bit easier to the community, and we really take this as an opportunity to work with our communities to look at how we can utilize those resources.
Yeah, I like that point. Good that you raised is that a lot of the frozen vegetables actually are quite nutritious because they are snap frozen. So the nutritional content is actually preserved. In fact, the fresher vegetables, the more time they spent in supermarket, they lose the nutritional value. So there's still room for that, because salads are something you're going to eat fresh and you're going to eat frozen. frozen, but there is a lot of room for frozen vegetables to be a part of the diet. They're so cheap, so convenient, but they're still whole foods. So really, we can make the most of it, and the price point doesn't increase.
Yeah, and that's what, we've done work in lunch boxes and how important that is. And that's what you do every day, and how you can keep that healthy. If you have any questions, please take this opportunity. We have Dr. Kerry Chant here. We have Nisha, a dietitian, and Dr. also endocrinologist, Dr. Tamara Milder here. Please put them in the chat. One of the questions I wanted to ask, and this is what Dr. Tamara had mentioned, is about checking the labels. That is so crucial. I mean, how do you look at a label and you look at it, and I need glasses on to check it, but what is it? If there's something to take away, Nisha, what is it that we need to remember about labels?
That's a good question. So one thing that I often say is when you read the ingredient list, remember the ingredients are listed from most to the least. So if you find sugar or fat or salt in the top 3, maybe look for an alternative. So that's one of the tips that I would give. The second is shorter the ingredient list, the better it is. So the less processed it is. So look for the ingredients. If there are so many long list of ingredients, and if a lot of that sounds like you cannot find that in your kitchen, maybe look for an alternative. And the other thing is you'll see in the nutrition information panel, there are 2 columns. There's per 100 grams and per serving. So when you look for specifically fiber from diabetes point of view, check, is there any fiber in there? And that'll give you an idea, okay, if I'm going to eat once, what is the amount of fiber I'm getting from this packaged food? We are aiming for about 25 to 30 grams of fiber for healthy individuals in a day. So you can then calculate, look, I'm eating 2 of these. What am I getting at the end of the day? Just a rough tip on that.
And I think probably the labels can be overwhelming. And again, we probably haven't got the time to sometimes digest it. We can use the Health Star rating system to compare if you're choosing a category, but it's really important that this is a comparison tool for a category of products. It doesn't mean you can compare that thing with another different category. So that's probably a really important element. But I would say just the practical basics of the more basic the food products, the better. So spend the most of your time in your, see what fruit and vegetables looking healthy and are at a cheap price point. Some of the tips that I like is the sometimes some grocery stores have mislooking fruit, which can be stewed. I can eat it, but if the children are put off, please stew it or process it. But spend as much time in the outside of the shopping, the shop. In the fruit section, the frozen food, the frozen peas and broccoli, that sort of section. Probably every time you go down the aisles towards the more processed food, there is probably a clarity that when you're walking down those aisles, and maybe avoid the aisles that particularly when you're hungry, you might put a few more in the trolley. So everyone falls. No one is perfect in this. We've all experience these challenges.
Absolutely. So I think the best thing is to go for shopping after you've had your meal. So go to buy what you need and not what you want.
That's a good tip. Dr. Tamara, do you want to add something to that?
Just one tip. If you are suffering or you think you're suffering, certainly I would discourage sugary drinks. They're really high in sugar. They're really high. And if you either have diabetes or you're pre-diabetes, it's just not a great thing to have because it's just really high and it's a drink and you're having more on board. And it's just a huge stress, especially if you're, if your body's trying but not, is struggling to make, insulin or, is quite insulin resistant. That's a real added stress. So that's one thing that if you're doing at the moment and if you stop doing, you're going to make a big difference to your overall health. So that's just one tip from me. Yeah.
And look, can I just echo that? That's probably what our research really shows. Sugar sweetened drinks are a really important element. Just also alcohol, just thinking about alcohol's contribution as well in terms of its calories. But we would really recommend water. Or think about some of the traditional sources of teas that are so widely used in different cultures and and just as a healthy alternative. Some of the juices have actually got quite a high sugar content, so just being cautious. You're probably best to stick with water as the preferred drink, and think about some of those other traditional teas and other things that are probably quite healthy.
Yeah, I think that's a good point. And because I see a lot of children in my private practice as well, I know the juice poppers are a common part of the recess that are being given. And I think if they have that throughout the childhood years, when they turn into young adults, they're going to resort to that as well. So I think choosing water as a main drink and using the whole fruit as a way if they want to snack on is the best thing.
And it is National Diabetes Week, and we have done resources, fact sheets that's just recently done for South Asian communities in 11 languages. But I think, Dr. Chant, there are services available, like a Get Healthy service that people can ring up.
That's correct. We've got a Get Healthy service, which for those people that really want some guide, all the way through to some guide to how to navigate some resources to support them understanding labels or supporting what would good nutrition look like for their circumstance, all the way through to that self-sustained coaching. We know that some people will benefit from having someone that they can talk to about their challenges and be guided through the process. It's a free service. It's got highly trained health coaches, they're exercise physiologists, nurses or dietitians. They will report back to your GP and provide that connection with your general practitioner. But also my first message would be your general practitioner is actually going to be really well armed, and your broader general practice may well have some really good resources. And we know that some general practitioners also embed some nurse educators and some other components to that. So please just prompt a discussion, ask the questions, should I be screened? Do I need a screening test for my kidney disease or for my diabetes? Because we know early intervention in those areas is good, as well as my cardiovascular risk. Try and do preventative visits, one preventative visit. We often hear that some communities rarely visit doctors unless they've got that very, very unwell. And what I'd say is just once a year at least, just go and do that prevention visit. Allow a long appointment time and really go through all the lists of the preventative healthcare. It's just as important as seeking care when you have an illness.
Dr. Tamara, we talk about how important research and data in your work. When is it time? Like Dr. Kerry is saying, it's time for screening. But do you need to know that they have symptoms, and what is it? When is it time? Do you need to go? Oh well, I'm so sick that's when I need to check up.
I mean, this is a really, really important point, Jess. Some of these diseases like diabetes, like blood pressure, hypertension, these are diseases that unfortunately, and it's in a lot of, the early stages when a lot of the damage is, being done, not being done, but when, where you can modify it, is asymptomatic, meaning you don't have symptoms. You might feel perfectly fine, but your sugar's not wonderful, your blood pressure is not wonderful. And that's the issue, is you might not have symptoms until it becomes very late your sugars are very high in the 20s, for example. So that's why I would really echo Dr. Chant's comments. Please, you can make you might not want to see a doctor, I understand that, but there's a lot you can do in these early stages of a disease. And I would just say it's not, as a diabetes doctor, it's not just about your sugar. Really important to get your blood pressure checked, your cholesterol checked. If you have diabetes, please check your urine, because that's a big part of it. You can do so much. You might feel perfectly fine, but if you can get on top of those risk factors, those conditions, you can make a big difference to preventing those complications that Dr. Chant talked about earlier, because they're not so pleasant. They cause a lot of problems later on, and it would make a big difference to treat early. So yes, it would I would really echo those comments. Yeah.
Dr. Chant, you said that your GP has said that you should be doing more now than before.
That's right. I think the challenge for us as we age is to age healthily. I think that's probably most people's aspirations. And it does mean that we've got to think about consciously how we take those opportunities to maintain a good, healthy diet, maintain the sleep, to engage in those preventative healthcare visits to the GP, but also how are we going to build into that physical activity and find the right physical activity for you. And I suppose my other looking at the data, I'm really probably a bit of a call to action is really families, thinking about how we can get the family moving more together. The data for your younger young adults, that 9 to 15-year-old age group, they're really not getting anywhere near enough physical activity. And, what can be a win-win for the family? And that's going to have to be negotiated carefully but can we find some exercises that brings the family joy as a unit?
And that means also eating together and also
Absolutely. I
playing
think
together.
It's a family-based approach, whether it's having meals and also kind of reminding families to have meals at the table, not in front of the screen. So when you are mindfully eating, you enjoy the meal, you bond, you eat as per your appetite. But when you have screen, you're eating, the volume that you eat can be more than what you need, and that can again increase your risk of diabetes as well. So yes, it's a family-based approach, which will be long-lasting.
Well, we've run out of time and we could go on about this, but Dr. Tamara, thank you for joining us. Any last words you'd like to tell the community, the media, and also the health workers today?
I personally think, if you have hope, like there is so much good advances that are happening in this area, and to, I know there's maybe in some communities stigma, but there's so much you can do. There's so much hope out there for diabetes. It's made so many advances. Yes, if we deal with it early, there's so much you can do to reverse it and be in a better health long term and live a healthier, more enjoyable life. So, if those tips today are helpful, I'm glad.
Thank you for all the work that you do as well, Dr. Tamara, and thank you for joining us. Nisha, any last words?
I would say the power is in you. So believe in yourself. We have a lot of support. Use the support and we can make a difference.
Thank you, Nisha, for joining us and for your
My
work.
pleasure.
Dr. Chant.
Look, I think I can't outdo Nisha's comment. I think we're not saying it's always easy, but the little steps and the power is with you, and a real plea to think about the family, the broad family. And maybe I've talked a lot about the younger children, but similarly, what activities can we keep for our elder members of our community, our family, to maintain activity, to have that social inclusion. And I think that's an absolute strength of our cultural and linguistically diverse communities. How wonderful that whole of family spending time together and ensuring there's a mix of activities that meets the needs of all of the members.
Thank you so much, Dr. Chant, for joining us. And thank you for being here today to talk about diabetes prevention on National Diabetes Week. I'm Jesusa Helaratne. As our guest said today, the power is with you. Take care and stay safe.